Thank you for this invitation, and really sorry not being there with you. First of all, I'm sick, and secondly, I mean, theoretically in holidays, so with people at home. So that's why I need to apologize not being there with you, and with my dearest friends and companions of all the things that we are all doing together to have better data on rare diseases. And what I will try to do in this keynote is to take you on why it is so important and why you are so important in making for this particular community, for this particular population of patients, data to be, let's say, usable for improving their lives, for improving rare disease research. So I a little bit of, so let me know if you see the slides going on. Yes? I hope you see the slides. Okay, so a little bit of disclaimer first. So I'm not a data scientist myself. I am a medical doctor, as Marco said, with a master's degree in philosophy as well. But I will try to give you a vision and a high-level vision on what is at stake about rare diseases and why is it challenging, and how Orphanet enters into play, and then how all together we are trying to do the world a little bit better for the rare disease community in terms of data. And I hope that you will understand so how important it is what you do for this community. So we will start with the first challenge, that is defining rare diseases. And that is not trivial at all. You see in my slide that in different geographies, you have different definitions. So from the beginning, we are not on the same page across the world. However, rare disease patients are scattered across the globe. So it is the first thing to do is to define what is a rare disease. And that is a huge effort. And this a never-ending effort. So expert groups have defined the rarity, so definition of what is rare, by the prevalence, meaning the number of people at the same time that are suffering from a disease, from a rare disease. But that's not possible for all kinds of diseases. So we have different kinds of definitions for cancers, for rare infectious diseases. So from the beginning, we have a little bit of, let's say, of a problem there, that is to agree on a common definition. So we know that rare diseases are low prevalence diseases, so they are rare, but low prevalence of what? A main principle in any epidemiological study, and from an epidemiological point of view, is to define the object of study. That is what we will count when we say that we have X many rare diseases over there. So how we define a disease? It is because of the clinical presentation of the patients, is because of the genes, is because of what? So, but it is extremely important that we fix that at the beginning in order to start working. So, and that is to answer your question, Marco, how the philosophy enters into play as well. What is a disease or a disorder? It's just a point of view. A disorder is a multidimensional thing that we can define very differently, the same disorder, depending on your point of view. If you're an epidemiologist, if you're a clinician, if you are a social worker, if you are a geneticist, if you are an epidemiologist, you will have different definitions for the same reality. Furthermore, a disorder is a level that in which you decide to focus. You can focus on the subtypes of a disorder and consider that they are the disorders, or in the disorders, or even broader at the group level, if you want. So we need to make a decision that could be arbitrary and try to make a decision less arbitrary as possible. But we need to collectively agree on a definition. So that is a very, let's say, a huge effort that the WHO, so the World Health Organization, has been conducting together with the main rare disease patient federation, that is RDI, Rare Disease International, in which they put all the experts across the world together and try to agree on things that at Orphanet we have thought about from decades, but that cannot be imposed, that should be adopted by the community in order that, agreeing on definitions, we can start doing things with these definitions. So the thing was to say, what is a disease and what is rare? And then explain how it impacts the rare disease community. So the thing, and the conclusion of that, to make for you the long story short, is that we have the core definition that you see here. A rare disease is a medical condition with a specific pattern of clinical signs and symptoms and findings. So it is a clinical definition. Whatever the cause, whatever if the disease is genetic or not, whatever if the gene is known or not, what is important is that clinically we can define an object that is a rare disease, and rare because the prevalence is fewer or equal to 1 in 3,000. And then we have what we call the framework definition, that is all the impacts of the rarity on this particular population of patients. These elements are very basic, but are very important, because without that, we cannot start talking each other, simply like that. So we have this definition, and now that we have this definition, we say, so the clinically oriented definition of what a rare disorder is, then we can count how many disorders are out there. We count how many disorders are out there, and we arrive to the conclusion that is a moving one, that is 6,000 and something. And then we can start describing what are these diseases. And then we have this nice picture that shows you where the challenge is. Because you have in green the patients, and in blue the diseases, okay? So you see that most of the patients are affected by few rare diseases, but most rare diseases affects very few patients each, making these patients the most vulnerable amongst the vulnerable. And in terms of data, what does it mean? It means that these to have data on these patients, we need to make a very big effort for few patients for a lot of diseases. And that is our challenge. So that is the direct impact of rarity, because we have patients scattered across the globe, and we need to find them, and we need to put the data together, achieve the critical mass of data in order that we can start understanding the impact in their daily life, the use of healthcare services, how can we look for treatments for them? Because sometimes, because they're monogenic, etc., maybe we can have a gene therapy for them and solve few patients really, but very impacted ones. So that is the challenge of rare diseases, which is very unique in the field of medicine. So which are the facts for rare diseases? We have this European definition that is now worldwide accepted, that is equal or less than 1 in 2,000 inhabitants. There are more than 6,000 rare disorders, including rare cancers. In Europe, there are 30 million European citizens affected, suffering directly from rare disease, and that is an underestimation because it's what we can count now. Most rare diseases, as I showed you before, concern a small number of patients each. They are clinically heterogeneous. Virtually every field in medicine is impacted by rare diseases. The vast majority start in childhood. They are chronic, they are disabling. But because they are so rare and so unknown, a lot of them wait 5 to 30 years and sometimes all their lives to be diagnosed, to have a name on their suffering. 40% are misdiagnosed, so misdiagnosed means mistreated. And there is a poor recognition, so the case recognition is extremely difficult, and I will go in depth on that because inappropriate coding. And they need for specific expertise, and in Europe we are very lucky that the expertise is well organized in what is called the European Reference Networks, the ERNs. And the main problem is that only 5% of rare diseases have a treatment that is not always curative, but they have a treatment. So you understand what is ahead in terms of research and development in the rare disease field. And I hope you understand more and more at which point it's important to have a critical mass of data. So that is the main challenge, because we need evidence, but we need to derive this evidence from scattered, inaccurate data across countries. And that is the fair challenge in the rare disease field. So the variety is the main challenge. The domain evolves a lot, and that is something that we follow, strictly follow at Orphanet. They are heterogeneous. We need data that are portable, that serves directly the patient, but that serves also a secondary use. I will go back on that. We need to have data that is reusable for different purposes. But the main problem is the invisibility of rare diseases in health information systems, where everything starts in terms of data. So ideally, and that is a pan-European recommendation, that the consensus recommendation, that we need to achieve a seamless ecosystem in rare disease data. Ideally, each patient will have their diagnosis codified properly. So in order that we accurately and unambiguously identify the diagnosis of the patient, And all the in the health systems, every piece of the care pathway for the patients will interact because they will recognize through this codification the diagnosis of the patient. And while doing that, data will be generated at the point of care and gathered together at the national level or at the hospital level in a way that is reusable. And then, if that happens in every country, then we can, in a federated way, in different contexts for different kinds of data, to achieve this famous critical mass of data, because we will be generating data in an accurate and unambiguous way, talking each other through a common language, and then not only because of the codification, and we will go across the data elements as well, but we will be able to have, let's say, data we can rely on for secondary use. So for evidence-based decision-making, understanding how the health system is used, where the needs are, where the expenditures are, and making a more rational use of health resources. And then for research, in order to improve patients' lives, not only through treatments, of course, we need therapies, but also understanding how other kinds of interventions can help patients in their daily life and their families and helpers, because they are really, all the families are impacted when a rare disease arrives in a family. So that is the ideal world we need to achieve. And that is where achieving fair data at the source, at the point of care, is necessary for rare disease patients. But how we do that? How we find rare diseases in these health information systems? Rare diseases are underrepresented. ICD-11, so International Classification of Diseases, is the most used one. ICD-10 and now 11 is the most used for medical statistics, but rare diseases are very poorly represented in those. In ICD-10, 83% of rare diseases do not have any code. The situation is a little bit better in ICD-11, but it's not that. But the codes are more often imprecise, meaning that you don't have a single code for each one of the disease. So, and nothing in these generic terminologies allows you to identify that the disease is rare or not. They are just diseases because they are, the goal of these terminologies is not to tackle the rare disease problem, but to make medical statistics. So we need a domain terminology that is specific for rare diseases, and we need to make that this domain terminology is interoperable with other medical terminologies. And that is where Orphanet enters into play. So there is a gap in terminologies that is specific, and this gap is what Orphanet delivers. The Orpha codes, that are the codes specific for rare diseases, is a domain-specific terminology. There are others. Cancer has domain-specific terminologies as well. So wherever there is a need for specific coding, we have a terminology that is domain-specific. The thing is that we need that this terminology is implemented in health information systems in order to give the start in data generation. And then by doing that, Orphanet is providing a common language, providing data and information around this common language, and by doing that, generating new knowledge for rare diseases that can be reused in research. And I will try to explain you a little bit more about that. Very shortly, if we don't know Orphanet, just know that it's a huge data resource that exists from 27 years now, and that is a global core biodata resource and Elixir core data resource, and that is involved in every single data-related project in Europe and beyond. So on reuse of data for decision making, on interoperability, on health data, on data for research. So as Marco said before, it's a major resource that is instrumental for other consortia or groups of people to use and for their own research and to make progress in all the different aspects and dimensions of rare diseases. So let's go now more in depth on this specific terminology. So we adopted this clinical definition to determine which are the level, what we call the aggregation level, that is the rare disorder level, that is by orange dots here. So when we count the 6,000 and something rare disorders, we are counting the orange dots. But that is that they are organized in a graph as a classification and as an ontology, so there are different formats, in which the disorders can be subdivided into subtypes if needed for clinical purposes, and of course grouped into rare disease relevant groupings until the system anomaly. So this classification of rare diseases that is quite unique allows for researchers, geneticists, for instance, to be interested in the purple dots, public health researchers to be interested in green dots, and clinicians to identify patients through the orange dots. And by putting all the points of view together, then you can gather together different points of view into a single system that is accurate and unambiguous in the way to name things and to identify things. And that in many languages, so as to improve also the cross-country dimension, the international dimension of rare diseases. So this Orphanet nomenclature of rare diseases, the Orpha codes, is a comprehensive, standardized, evidence-based, based on the literature, interoperable, version, computable, and free resource for case identification in health systems, in registries, and in other kinds of resources. What is in there? You have a main term, you have as many synonyms as necessary in each language, you have a definition that helps coders to find the right code, and the unique identifier, the Orpha code. So what does it allow for? So you have the code. The code is a number, an alphanumeric chain of characters that allows to interoperate across countries, across languages, but also across domains, from care to research. It also, in the nomenclature system, we are producing mappings, so alignments with other terminologies. Here in the slide you have ICD-11, but it's also ICD-10, UMLS, NOMED, and other terminologies, in order that in these generic terminologies where every dot is a disease, to highlight where are the rare diseases in it, because there is not another way to do that. And then to understand how the concepts are related in a computable way. So are the concepts identical, or broader to narrower, or narrow to broader, etc. So how the terminologies are comparable or not. So now the ORFA codes are aligned with several terminologies and also aligned with other standards for other pieces of information to describe rare diseases, and that are disabilities using the International Classification of Functioning, phenotypes using the Human Phenotype Ontology, genes using the Human Gene Nomenclature, and then from there linking to other genetic terminologies and resources. So putting all this together makes that you have a resource that is based on a domain a classification and ontology, and that puts together all the elements around the knowledge on rare diseases in a way that these elements are made reusable for research. So of course, the knowledge base that is built by Orphanet center on this rare disease nomenclature and aggregating a lot of data in a standardized way. All this is delivered through a website for information, so that is for the general public, for medical doctors that are not experts on rare diseases, etc., for their information. But they are aggregated in reusable ways through ontology, so Ordo, that is Orphanet Rare Disease Ontology, and ontological module, so bridging together two ontologies, Ordo and HPO, and then through a series of data files, formats, and tools, making all the content in this huge knowledge base reusable for researchers, for the industry, and also by the health systems in different formats. So you can, everything it is in the orphadata.com website, and all the scientific, so open science information that is Orphadata Science. You can go and explore that, and Mark is in the room to take you across Orphadata if you need. So of course it is also in fair sharing. I will go through that in BioPortal for the ontology and so on and so forth. So little pause. So what now I want to show you is how we use that in different projects. It is very good to have a resource and to have the ORFA codes, but now we need them to be implemented, real life implemented in hospitals. And for that, we are working with the European reference networks that sit in hospitals across Europe. And we have built what we call a national hub network in which all the Orphanet teams, because Orphanet is a big network implemented in each European country, to help out with the real life implementation. So providing local support in local language to hospitals in order that they know how to implement, and coders how to code correctly with the ORFA codes. So that is what we are delivering now on top of delivering the nomenclature. So what is that? It's tackling the human factor, because you have the recommendations, you have the resource, but then you have people that need to use and understand this resource and generate data, because the urgency is to generate data that is reliable. So we have a help desk, and we have teams that are training people and that are accompanying people hand in hand at the country level. And when you do that, you can start generating things out of the data. That is an example from in a French National Registry of Rare Diseases that is fed directly from electronic health records, and that could follow the medical activity during the COVID crisis in the different networks, national networks for rare diseases. And that could have been impossible without the ORFA codes implemented in the electronic health records. Ideally, and that is something that now is happening, so you will have the electronic health records and then the data lakes in the at the country level, and then the federation of data lakes of data health data spaces that will be the European health data space at the European level. So when it will arrive, then we will start having real-world evidence on rare diseases. But that is for health data. But now for research, the research landscape is not better because we face a big fragmentation, heterogeneity, and lack of interoperability. And so we started working 5 years ago in a big project together with Marco and plenty of people in the room. That is the European Joint Program on Rare Diseases, EJPRD, in which what we try to do is to harmonize the way different resources that are not talking each other, are not speaking the same language, can be used together for rare disease research. Remember, we need therapies, we need clinical research on rare diseases. And the first thing was to implement the ORFA codes in the different resources in order that they can talk to each other when it comes to their rare disease content. Not all are rare disease specific, but they have content that is relevant for rare diseases. So what we are trying to do in this federated system that we call the virtual platform, you had a workshop on that, so I won't go so into detail, is to have now, based on ORFA codes, but also based on data models, a way to interoperate between different resources that are completely heterogeneous, but that they work together for rare disease research because they are tackling the different dimensions of this multi-dimension rare disease field. So for that, we as Orphanet, we are providing services that help out achieving this interoperability. So, and I won't go into details because Mark is there and he can explain you better than me all these things that help out implementing the ORFA codes, but also using the Orphanet knowledge base in a way that makes the other resources, so the combination of this core knowledge base with other resources, other data sources, to generate better data and to interoperate with each other. In the virtual platform, the resources can just connect to each other or all together in this virtual platform by their description of their metadata, what is the resource, the description of their content, what they content, and also allowing to do things with their content, with their data. That is what we call the level 3, finally, only level 3, that is answer complex research questions. And to do all that, we need to, we adopted by design a federated model in which the data, the content, of course, stays at the source, and then the different the metadata and data are exposed in a fair, compliant way by design to the virtual platform network and discoverable through a virtual platform portal that is just a way to make the virtual platform network, which is the important thing, visible. So for that, we are using fair by design ways of doing. So first of all, describing the resources by their metadata. So adopting a DCAT-based metadata model for exposing what the resources are. But then using a data model that I won't make the insult to Mark Wilkinson to explain it, because he's there and he's one of the creators to do that. That is a CARE-SM, Clinical and Registry Entry Semantic Model. That is a comprehensive data model that allows, that is fair by design, as I said before, but that allows them to do more interesting things like federated analysis on fair data. And I hope you enjoyed a workshop on that in the previous day, Barco, if I am not mistaken. But in the HAPRD, we are also tackling the human factor, but accompanying the data producers to adopt all these models and the technicalities around in order that they can onboard on the virtual platform as a network. But onboarding means making their resources better, fair at the source, in order to deliver better data for rare diseases research. And that are all the onboarding and verification effort. So all the tools and methods that are delivered to researchers, but also the hand-in-hand guidance, as I explained before for the Orpha coding in hospitals, here is to make all their data fair at the source and reusable in this virtual platform as a single, let's say, federated but still single home for rare disease data for research. So in conclusion, I hope you have understood where the challenges are for rare diseases, how hard it is to generate data and to exploit data. We are not already there, but we are in a much better shape now than we were in the past. Rare diseases is a paradigmatic domain in terms of need of fair. Without fair, we won't, so we will spend our time cleaning data and trying to understand if the data is meaningful and usable, instead of just using data. And that is the big difference that we expect for the future. The very, very first step of the rare disease data journey is the visibility, and that is the main Orphanet contribution with the Orpha codes. And then the rare disease data is a story of standards, tools, methods, and humans. And now I think that we are in a very interesting times because the field is mature enough to bring in major connecting the dots opportunities that are in the field of care, a joint action, so all the member states working together in order to integrate the rare diseases in health systems and national health systems, and that encompasses data. In the research, because after HAPRD, we are now scaling up at the European and international level for rare disease research. So all that we have done as a virtual platform will be scaled up in the next 7 years. And for codification, that is the Orphanet data for rare diseases projects, in which, as I said before, we continue generating the Orpha codes, but we provide a professional services for Orpha codes implementation at the source. And with that, I thank you very much for your attention, and I'm here for questions if you want.
Thank you, Anna, for that awesome talk. Before we go to questions, I want you all to think about questions. I think Slido is working again because it was not working for a while. But I would like to ask you one thing, and I'm sure that Anna won't mind that I ask this. Tomorrow is Rare Disease Day. And it's one of the reasons why Anna is not here is because of Rare Disease Day. So that's a very important day for all the people working in the rare disease field. And the typical thing we do on Rare Disease Day to show support to the rare disease patients is to raise our hands for rare diseases. So if you don't mind, I thought it would be fitting for this session with you, Anna, is if you could do that, and I'll take a picture, because then I can say SWOT for HCLS raises their hands for rare diseases. So if you don't mind, I will get my phone. Wait 1 second. I need to make the pic. I need to get my phone. And I'll stand as far back as I can. So please all raise your hands.
Thank you very much, Marco, reminding that.
So
I should have started by that.
Well, actually, Anna, that's my fault because it was on my list to start with that, but I forgot. So now we've done it. And I think after your talk, we know why. So questions for Anna. We have a few minutes for that. So on the left. So do you have a microphone, Rick? Yes.
Yes, I do.
The microphone is coming to you.
Yeah, thanks, Anna, and thanks, everyone who is involved in this initiative. My name is Dušan Milovanović. I'm Health Intelligence Architect at WHO. But I actually have a question as a parent of a patient who has rare, undiagnosed disease for the last 20 years. So I have a question, but I would like to reiterate some things you said just to confirm that this is true and how it looks like from our perspective. And then it's leading to a question that I have. I talked with your colleagues, so they know the question already, or the cocktail party. But so, I mean, it's definitely true that labels, as I call them, or points of view, as you call, they're part of the problem, not the solution. So somehow we need to simplify things in order to tackle them. And academically, it makes sense to me, but it's not practical. If we need to have a name of a disease, then you have a lot of people, I can witness that, left over. And as you said, we don't know how many. So somehow, because of mostly academic approach to rare diseases in Europe, we have in Orphanet database consists mostly of those diseases who have a name, and they have a name because there is suspected or known underlying genetic disorder. For all those who don't have any genetic disorder discovered, they're left over. I'll give you one example. If you try to find autoimmune encephalitis, you'll find only autoimmune limbic encephalitis with a definition that is old. And then that leads to my next comment that also reiterates what you said. So the whole approach in Europe is pretty much, I would say, eminence-based. You talked about hospitals, you talked about state level, you talked about European level. And with due respect, we're waiting for 20 years, 30 years. It's very, very slow. In hospitals around Europe, and we're usually in many hospitals around Europe or even US trying to find a solution, we are failing to provide or to give information that is used on a daily basis for fine-tuning, treating patients, understanding their condition, because it's a very slow process of creating these data models and whatnot. Now, again, I'm architect and I know what the complexities are, and I also know how you reach out to the solution. So that leads me to maybe one more comment. ERN, I was really happy when I heard about European reference networks, but then unfortunately for us, they only have academic approach. And you talk about practical problems. How do we, use the very good concept of fair data, but then really have implementations and basically, reach out to where this is needed. We need knowledge, and we need academic approach, but this is not enough. And so that leads me to a question, actually. It is about diagnosis as well. It's not about curing. I mean, it's very, very often, there's so many unknowns, but it's much easier to live with diagnosis. And diagnosis is not a label. It's really understanding the whole, how the body works and what are the problems that could be tackled to alleviate symptoms at least. So this is missing because everybody's looking at labels. Doctors are waiting for Orphanet to find name of the disease, and for example, my daughter's doctors. And then we are trying to work together to provide some data. So here's my proposal and a very simple question. There is maybe a way to accelerate all this. If you include patients, if we can build a platform where I can be your data provider. I'll give you all the data that cannot find place in any electronic or paper-based record. Actually, paper was easier, it was there, but electronic make it problem. In any of the big hospitals across Atlantic, including Geneva right now. So that's an idea. The question is, is there any idea to include more directly patients so that we can help you to accelerate? And actually, if you include us, you have much more data for research, and some of these problems in the research will be solved. So sorry if it was a little bit longer, but yeah, thanks.
No, but it's a very valid point. But Anna is the expert for the
Okay.
answer.
So there are a lot of things to say, and thank you very much for this point of view, because it is exactly what it is about. So first of all, on putting a name on a disease, that is of course what everything starts. So a patient needs to have a name on their disease or their children's disease. That is sometimes possible and sometimes not, because the knowledge is not already consolidated enough to understand if we are talking about a single disease, let's say, a manifestation of another disease, or a disease that can be described clinically, but that has not an explanation already. And that is the difficulty on the case definition that I talked at the beginning. In Orphanet, we created a code for undiagnosed patients because because we know, and unfortunately, it is a reality, is part of the reality of rare diseases, that a lot of patients have, as for today, no diagnosis possible at the level of knowledge at that moment in the scientific field. So, but these patients are, because they don't have a name, they are invisible. If the rare disease patients with a name are invisible, those are the most invisible. So we decided to create a code that is a code for patients that remain undiagnosed despite all the available clinical investigations. And that could be different in different geographies, in different health systems. But it allows to, let's say, to identify this population and to propose a research pathway into this population. You talk about autoimmune encephalitis, that is a piece of the classification that was recently revised in Orphanet with a panel of experts, because this is a field that is moving, that has moved and changed in the last years very, very, very profoundly as well. And yes, the patient data and the patient point of view is important and should be encouraged. But then I think that defining or putting boundaries in the case definition, defining what a disease is a co-construction made from the knowledge from patients, from the knowledge from doctors, from the knowledge from scientists. And I think that this kind of proposals that you are doing, that is extremely valuable, should be taken by the European reference networks in the case retrieval in registries, because they are pulling cases from different geographies that can maybe make it happen to have the first, the second, the third case and to define a new disease. And with a new disease is proposed is when Orphanet enters into play together with ERNs, because we are working together in the definition of rare diseases and in definition of ORPHA codes, and the definition on names and description of rare diseases. Then what I call a disease that is consolidated. It doesn't ask for too much, 2 independent cases that could be identified as having the same disease. And then it takes a code and it takes a name and it helps finding the 3rd, the 4th, etc., and starting, so at the beginning of the story of a disease to having data. That is unfortunately not possible for all the cases. And a lot is to be discovered yet in the rare disease field. But that is how I see things. It's not Orphanet as an institution that is determining what is that and what is not that. It is a co-construction between us, between patients, between doctors, between scientists. And then we really work in collaboration. And that should be documented because we need accuracy. Accuracy is extremely important, not to generate wrong data, misleading data, and taking one disease for another. So that is, we need to be really very strict in the methodology.